Nobody move! I'm getting a dustpan. Oh.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards.
Yeah, maybe she should forget about the shin guards. That Go Red for Women campaign with a PSA about heart attacks in women, heart disease, one of the #1 killers for people around the country, including women. Is there anything we can do to change this disturbing trend? Joining me now is Dr. Stephen Masley, author of the 30-Day Heart Tune-Up. Doctor, it's great to have you with us.
Great to be here. Thank you.
All right, so women often underestimate their own health when it comes to their concerns with heart disease. Why did you write the 30-Day Heart Tune-Up?
Well, I really wanted to help the millions of people out there. The #1 killer for men and women is heart disease. This has happened in my own family. It's happened to my patients. We can prevent 90% of heart disease with lifestyle changes. So it's time we help people make that happen.
Well, talk about the main lifestyle change that folks should focus on if they are interested in making their heart healthier.
Well, we've actually looked in our clinic at what causes people to grow plaque, and plaque in your arteries is the #1 cause for heart disease, and what lifestyles predict that. And it really comes out with F factors for F. So fitness was really #1. If you get fitter, you grow less plaque, you protect your arteries. Fiber was very powerful. Fiber we get from vegetable, fruit, beans, and nuts. Fish turned out, whether it's fish oil supplements or fish, was really great. And then there's specific food nutrients that really make a big difference for people's health. So it's something really easy to follow.
All right, so let's talk a little bit more about our healthcare system. Is it more focused on treating the symptoms or actually preventing those symptoms from developing?
Well, we spend 90% of our financial resources with procedures and hospital care. We can do so much better than that. With lifestyle alone, we can prevent 90% of heart disease, and we need to start doing that today. So all of your viewers out there, this is their chance to make changes that will prevent heart disease, and if they or a loved one have it, you can start reversing heart disease right now too.
Well, I want to ask you a question based on the ruling by the Supreme Court today upholding those federal subsidies. The stated purpose of Obamacare was transitioning patients from the treatment phase more into the prevention phase. How do you think the law is doing on that front?
Well, what we need to do is give people access and information. So until doctors and patients work together, I'm not convinced it'll make that big a difference. What we need focuses on, people need to really look at what are the real causes for heart disease. The truth ones are being fit, eating key food nutrients, getting fiber in your diet. That's much more important than I think than what we've been, the treatment modality you're referring to. So we really need a shift in healthcare today to make this happen. And I don't think Obamacare is going to have a big impact on that. It's the relationship between patients and doctors, and patients can do 90% of the work in preventing heart disease. So I'm ready to help them starting immediately.
But doctor, do you find that people who do take these steps, eat right, exercise more, do these things for their heart, do you find you have a better relationship than with, say, a patient who might be in more denial about their own health?
Well, clearly, because the biggest difference is they feel so much better. They sleep better, their energy improves, they're losing weight. When you enhance someone's circulation, you even improve their romantic life. So their quality of life improves from the get-go. And oftentimes by a month, I'm able to help people stop their medications. We can help get them off their diabetic med, their blood pressure med, their cholesterol meds. They're able to stop those. They feel better. It's terrific. I love it when I can help people improve the quality of their lives.
All right, Dr. Masley, thanks so much for being with us. That's another way to reduce the cost of healthcare is get off a lot of those pharmaceuticals out there. Dr. Masley is the author of the 30-Day Heart Tune-Up. Pleasure to talk with you, doctor. Have a great day.
Thank you.